Hey there, today we are looking at the misconception of breast cancer to fibrocystic breast. It is very unfortunate that there is no test out there for the early detection of cancer. And so your number one test for the early detection of cancer is going to be prevention. And I'd like to speak to the men out there. We may help in a way of bringing down the cases of breast cancer in women by learning the right way of handling the breast of women. It's very sad and absurd how some men hold the breast of women. I don't know if we are just trying to sprint with their breast like what they do in basketball. It's not funny. It's because I'm saying this because when the breast is mishandled, there is an inflammation, and here is the key: the cancerous cell, they walk or they run to where there is inflammation. So imagine you hold breast anyhow. You are not patient with holding the breast. You don't even know how to massage the breast. You just dangle it and you try to play with it anyhow. You should remember that it is also part of her skin. And so I think that if you're watching this video and you're a man, you need to, be sensitive about this matter, because where there is an inflammation, cancer goes there to actually multiply, and that is something that we would want to avoid. All right, so the presentation may not be complete if we don't talk about the common diagnostic test for breast cancer that a lot of people have been told that they have cancer from this test. We want to look at this diagnostic test because it's questionable, and there is something that you need to know before you make a decision if you want to be confirmed with your breast condition on that diagnostic test. Of course, it is the mammograms and the thermography. So in a moment, we like to talk about the mammogram. This test has not really decreased the risk of dying from breast cancer. However, the mammograms have rather increased the risk of doing more harm to the breast, and that is 3 to 10 times. This is because this test compresses the breast. They are using radiation, of course, to see the breast, and the very nature of cancer that has originated from some trauma to your cells, specifically the mitochondria, from something, and both trauma and radioactive trauma can trigger damage to your mitochondria. So if you decide to do a mammogram, you should just know the risk harm, that is 3 to 10 times. And then we talk about the thermography. The thermography is less traumatic, and of course it picks very little things, but it does not really for sure tells you that this is cancer. It is not actually the exact confirmation that these things that it's been able to pick is cancer. Many people have been diagnosed with cancer from mammogram and thermography and ended up getting surgery, chemo, radiation, removing the breast to find out when they really didn't have cancer. So one would want to make sure that he or she has cancer before he does anything radical. Like I said, unfortunately, there is no test out there for early detection of cancer, so your best solution is going to be the prevention. All right, so briefly, let's talk about some of the warning signs. The first one is you realize that there is an enlargement in your breast. One of your breasts, you see that it's swollen, and you can tell that it's not symmetrical. There is difference. There is an enlargement, and so this could be an indication. There could also be palpable nodules in your breast, and that's different from when you start to feel a nodule close to your armpit. Chances are that could be a lymph node that's swollen. Maybe you are coming down with some infection, so you just have to note that. Just because you get that doesn't at all means that you have cancer, and so we also need to watch that. There is also tenderness, and it could be cancer, but sometimes cancer has no pain, so this is quite vague. It could potentially be an indicator, but not necessarily. There could also be changing color. If the breast tissue is changing like a reddish color, this could be an indication. Skin changes, especially around the nipples, if it's flaky or there's some rough areas that could indicate possible breast cancer. There should also be an indication of blood discharge from the nipples that indicate breast cancer. Now, just because you have one or more of this does not mean you have cancer. It could be that you have fibrocystic breast, which are kind of these small little cysts that develop because you have iodine deficiency. Or it could be that the bra that you are wearing is too tight, creating redness or tenderness. If you know somebody dealing with cancer, you may also encourage them to be doing prolonged fasting. Prolonged fasting has been found to help deal with cancer, and so they may also take advantage of that. And also foods that do not destroy the mitochondria. And you may be wondering, what kind of food is that? Of course, that is a low carbohydrate diet, that is keto diet or ketogenic diet. And also you would have to teach yourself how to reduce stress in your life. It is also going to help you not to let the cancer overcome you, but you're going to overcome the cancerous cells that are actually moving to where there are old injuries, there are inflammations and all that. And so this brings us to the end of today's video. If you have any question about what we talked about today, please put it down in the comment section. And I really appreciate you for watching. Hope to see you another time. Thanks for watching. Bye-bye.